So I want to tell you a story. Last week I was in the emergency department and I picked up a chart, and there was this 3-year-old child coming in, and he had abdominal pain and he had some vomiting from the night before, and he went to see his doctor, and in his doctor's office there was also a radiology suite and they could do ultrasounds there. So he had a ultrasound done there and they thought he had an appendicitis, and with that diagnosis he was sent to the emergency department. When I come into the room, I see this child who was in moderate pain, and when I examine him, his abdomen was tender, but he didn't have any rebound. Now, since he had the diagnosis of appendicitis, I took the ultrasound with me to the exam room, and I said, I'll just take a look. So I used the linear probe, and I asked the child, where does it hurt the most? And he pointed to that area, and in appendicitis, that's where you start. So I put the transducer right over the point of maximal tenderness, and I start scanning, and all I can see is just normal bowel. So usually you start at that point, but since the appendix is long and it can go to many directions, you start scanning in bigger and bigger circles. And once I was scanning and I'm moving a little upwards, suddenly I saw the familiar donut sign of the intussusception. And I said, okay, and I moved the transducer to the longitudinal view, and suddenly I saw the pseudokidney. So this child suddenly changed from having appendicitis to intussusception. Had I not had point of care ultrasound with me, it would have taken much longer to get a more direct and concrete diagnosis. Through point of care ultrasound, we were able to treat him, expedite his care, and send him home healthy faster.